Question number 1. The neonatal period extends from birth up to option number C, 28 days. Option number C is the right answer. Question number 2. A newborn weighing less than 2500 gram at birth is classified as. Students, remember that anything lesser than 3000 gram or 3 kg is low birth weight. Option number A is the right answer. Question number 3. The Apgar score is assessed at option number D, 1 and 3 minutes. Option number D is the right answer. Question 4. Normal respiratory rate of a newborn is option B, 30 to 60 per minute. Option number B is the right answer. Question 5. The most common cause of neonatal jaundice is option number C, physiological jaundice. Option number C is the right answer. Next question. 6. Which reflex disappears last in infancy? Option A is the right answer, Babinski. 7. The first stool passed by a newborn is called option D, meconium. It is called meconium. Question 8. Normal heart rate of a newborn is option B, 100 to 160 per minute. Question 9. The most accurate method of measuring neonatal temperature is option C, auxiliary. Option C is the right answer for this question. 10. Which condition is caused by delayed passage of meconium? Option A is the right answer, Hirschsprung disease. Option A is the right answer. 11. A newborn delivered before 37 weeks is termed preterm. Option D is the right answer. 12. The primary source of weight loss in newborn is option B, evaporation. 13. Vitamin K is administered to prevent option C, hemorrhagic disease. Question 14. Caput succedaneum crosses suture lines because it is option A, subcutaneous edema. Option A is the right answer. Question 15. Cephal hematoma is caused by bleeding beneath option D, periosteum. Option D is the right answer. 16. Normal head circumference of a term newborn is option B, anything between 34 to 36 centimeter. 17. The earliest sign of hypoglycemia in a newborn is option C, jitteriness. 18. Which is the best indicator of adequate breastfeeding? Option A is the right answer, weight gain. 19. A newborn should pass urine within 24 hours of time. Option D is the right answer. 20. The golden hour in neonatal care refers to option B is the right answer, first hour after birth. 21. Which vaccine is given at birth? Option C is the right answer, BCG. 22. The most common cause of respiratory distress in preterm neonates is option A is the right answer, the RDS. 23. Kangaroo mother care mainly helps in option D is the right answer, the temperature regulation. Question number 24. A sunken anterior fontanelle indicates which of the following? Option B is the right answer, the dehydration. 25. An umbilical cord normally falls off within 10 to 14 days. Option C is the right answer. 26. Which condition presents with projectile vomiting in infants? Pyloric stenosis. Option A is the right answer. 27. The normal blood glucose level in a newborn is option number D, 40 to 60 milligram per deciliter. Option number D is the right answer. 28. Neonatal sepsis most commonly presents with option B is the right answer, lethargy. 29. Vernix caseosa primarily helps in skin protection. Option B is the right answer. 30. Which reflex indicates neurological maturity? Option B is the right answer, Moro. 31. Which newborn condition is a medical emergency? Option C is the right answer, cyanosis. 32. A newborn delivered after 42 weeks is termed postterm. Option B is the right answer. 33. The first breath of a newborn is triggered mainly by option D, hypoxia. 34. Which is not a sign of respiratory distress? Option B is the right answer, bradycardia. 35. The most common site for neonatal IV access is option C is the right answer, the scalp vein. 36. Breastfeeding should ideally start within an hour. Option A is the right answer. 37. Colostrum is rich in option D, antibodies. It is rich in antibodies. 38. Which is a danger sign in a newborn? Option B is the right answer, poor feeding. 39. The normal pH of a neonatal blood is option C, 7.35 to 7.45. 40. Which assessment tool evaluates gestational age? Option C is the right answer, the Ballard score. 41. Which neonatal reflex disappears by 4 months? Option E, Moro. Moro disappears by 4 months. 42. The main cause of neonatal hypothermia is option C, large surface area. 43. A newborn with yellow staining on skin on day 2 most likely has which of the following diseases? Physiological jaundice. Option A is the right answer. 44. Which vitamin deficiency causes hemorrhagic disease of a newborn? Option D, vitamin K, deficiency of vitamin K. 45. The average birth weight of a term newborn is option D, 3 kgs or 3000 gram. 46. The most common neonatal infection is option A, sepsis. 47. Normal oxygen saturation in a healthy newborn is 95 to 100%. Option C is the right answer. 48. Which is the safest method to identify a newborn? Option A, mother-baby matching ID band. 49. Which condition is characterized by greenish discoloration of amniotic fluid? Option D is the right answer, meconium aspiration. Question 50. The most sensitive indicator of neonatal hypoxia is option B is the right answer, the heart rate. Students, here comes the end of the video. If you enjoyed this video, please do like the video, share the video with your friends, and if you have not subscribed to the channel, please subscribe.